You're here because, well, you want to understand depression more deeply, right? And it's something that touches so many lives, but it's often misunderstood. So we're going to do a deep dive today into the World Health Organization's data and some expert insights from the American Psychological Association. We're hoping to uncover what you really need to know about depression.
It's pretty fascinating, isn't it? Depression affects a huge number of people. The WHO estimates 5% of adults globally.
Yeah.
And yet, it's still surrounded by so much stigma. And that can be, a real barrier to getting help.
It really is. It makes you wonder why something that is so prevalent is so often kept hidden. So, first things first, let's get some clarity on what we're dealing with. What is depression? Beyond just feeling blue.
Yeah, that's a crucial point because it is much more than just sadness. The WHO defines it as a depressed mood or loss of pleasure or interest in activities for long periods. And, this isn't just a fleeting thing. It's a serious mental disorder. And it can impact every corner of a person's life, their relationships, their work, even the physical health.
And when we talk about it affecting so many people, it's not just a tiny percentage of the population.
Absolutely not. That 5% globally translates to millions and millions of individuals, and it's even more prevalent in women. Over 10% of pregnant women and new mothers experience depression. And, that just highlights the need for targeted support during such a vulnerable time. Sadly, depression is also a leading cause of suicide, especially among young people, where it's the fourth leading cause of death. And that's a stark reminder of why understanding this condition is so important.
Yeah. It's really sobering to hear those numbers. It really highlights the need to recognize the various ways that depression can show up. Because it's not always like the stereotypical picture of sadness, is it?
No, not at all. While sadness is a hallmark symptom, there's a whole range of less obvious signs too. Difficulty concentrating, excessive guilt, shifts in sleep patterns, persistent fatigue, even physical symptoms like, chronic pain or headaches can all be part of the picture.
So recognizing it can be trickier than we might think. It's not just one single presentation.
Exactly. And on top of that, depression isn't like a one-size-fits-all disorder either. There are different types. There's single episode, meaning it occurs only once. There's recurrent, where individuals experience multiple episodes. And then there's bipolar disorder, which is a bit more complex.
Okay. Bipolar disorder is often mentioned alongside depression, but it has its own unique features, doesn't it?
Yeah, it does. Bipolar disorder involves periods of depression, but it also includes distinct periods of mania. And during a manic episode, someone might experience, intense euphoria, irritability, increased energy, racing thoughts, decreased need for sleep, and even impulsive behavior. Understanding these different types is super crucial for seeking the right help.
It seems like getting the right diagnosis is key, especially with the distinctions between things like major depression and bipolar disorder. How can someone ensure that they're getting the right help?
Well, the first step is acknowledging that something isn't right and seeking professional help. A licensed psychologist or another qualified mental health professional can conduct a thorough assessment considering individual symptoms, their history, and any potential contributing factors.
So instead of self-diagnosing, it's essential to get an expert opinion.
Absolutely.
Yeah.
Now, once someone has a diagnosis, understanding the potential causes can be pretty empowering.
You're right. Knowing the why can sometimes help with the what now. So what leads to depression in the first place? Is it purely biological? Or are there other factors at play?
Well, it's not a simple answer. Depression arises from a complex interplay of biological, psychological, and social factors. Our genes can predispose us, but life events like, job loss, grief, or trauma can significantly increase the risk.
So it's almost like a vicious cycle. Adverse life events can trigger depression, and then, depression can make it harder to cope with those life's challenges.
That's a great way to put it. And what's even more interesting is that many risk factors for depression, like physical inactivity or alcohol abuse, are also risk factors for physical diseases, like heart disease and cancer. This highlights the interconnectedness of our mental and physical health.
That connection between depression and physical health is something I hadn't really considered before. Can you elaborate on that?
Of course. So the same biological mechanisms that contribute to depression can also affect our cardiovascular system, immune function, and even cellular processes. This means that addressing depression isn't just about improving, mental well-being, but also about protecting our overall health. It's a powerful reminder that Taking care of our minds is just as important as taking care of our bodies.
Absolutely. Now, knowing that depression has such a profound impact on our lives, the good news is that there are things we can do about it, right?
Yes, there is hope. In fact, research shows that prevention programs can actually reduce the risk of depression.
What kind of programs are we talking about here?
Imagine this, a school program teaching teenagers mindfulness techniques. It not only helps them cope with stress, but actually reduces their risk of developing depression later in life. That's the power of prevention. For older adults, exercise programs have been proven effective in preventing depression. Equipping individuals with the tools and support they need to navigate life's challenges and build resilience is key.
It seems like a lot of times we're just reacting to mental health problems instead of proactively addressing them. Taking a proactive approach through these programs could potentially prevent a lot of suffering. But what happens when someone's already struggling? What are their options?
The encouraging news is that there are effective treatments available, both psychotherapy and medication. Oftentimes, psychotherapy or talk therapy is the first line of treatment, especially for mild depression.
I'm particularly interested in learning more about CBT, cognitive behavioral therapy, and IPT, interpersonal therapy. They seem to be getting a lot of attention these days. Can you explain why they are so effective?
Certainly. So CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to depression. It helps you develop healthier coping mechanisms and challenge those negative thought loops. Essentially, it helps retrain your thinking. IPT, on the other hand, focuses on improving interpersonal relationships and communication patterns. So addressing how difficulties in relationships can contribute to depression and helping you build stronger, social support networks.
So it looks at the role relationships play in our mental well-being. These therapies sound incredibly helpful. What about medication? When is that usually considered?
Antidepressant medications, like SSRIs, selective serotonin reuptake inhibitors, can be very helpful, particularly for moderate to severe depression. However, they're not always necessary, especially in milder cases. And the decision to use medication should always be made, in consultation with a qualified mental health professional.
That makes sense. It's about finding the right treatment plan for each individual's needs. Before we move on to the next part of our deep dive into understanding depression, do you have any final thoughts for our listeners about this initial understanding of what depression is and how it can be addressed?
What's fascinating here is how prevalent depression is, yet how often it remains hidden or misunderstood. If we connect this to the bigger picture, it raises an important question. How can we as a society encourage a more proactive and open approach to mental health?
That's a great question to ponder. We'll delve further into these topics and explore more practical strategies for managing depression in part 2 of our deep dive. Stay tuned.
Welcome back to our deep dive into understanding depression. We've uncovered a lot already, but there's still so much more to explore.
We have covered a lot of ground. In part 1, we talked about how depression is defined, just how common it is, the diverse ways that it can manifest, and even touched on the complex factors that contribute to it. We also started discussing, seeking professional help and the self-care strategies that can be really helpful.
And I think it bears repeating that there is hope. Depression is treatable. There are effective approaches that can help individuals regain control of their lives.
With the weight of this issue becoming clearer, let's explore that encouraging news. There are effective treatments available, and knowing your options is empowering. So where do we go from here? What are some practical steps people can take to manage depression, both for themselves and for those they care about?
Let's revisit self-care. It might seem simple, but weaving healthy habits into your everyday routine can make a world of difference. Remember those tips we mentioned earlier, staying physically active, connecting with loved ones, maintaining those routines? These are all powerful tools in managing depression.
Right, and I think it's important to emphasize that even small steps can have a big impact. It doesn't have to be about running a marathon or having a huge social gathering. A short walk in nature, a phone call with a friend, even just taking a few minutes to practice mindfulness or deep breathing can make a difference. It feels a lot less daunting that way.
Absolutely. It's about finding what works for you and incorporating those activities consistently into your life. Another crucial aspect of self-care is learning to manage stress effectively.
Stress seems to play such a significant role in our overall well-being. It's definitely connected to depression, but I think so many of us feel like we're constantly under pressure and don't know how to change that.
Learning healthy coping mechanisms for stress can be invaluable. This might involve practicing relaxation techniques like meditation or yoga, setting realistic boundaries, and learning to say no when needed.
Learning to say no is something I personally struggle with. There's always that pressure to please everyone and take on too much, but I'm realizing that saying no can actually be a form of self care, a way to protect my own mental well being. Now, what about the role of sleep? I know sleep disturbances are a common symptom of depression, but can improving sleep quality actually help manage the condition?
That's a fantastic question, and the answer is a resounding yes. Sleep is essential for both our physical and mental health. Prioritizing good sleep hygiene can be a game changer for individuals dealing with depression.
So, what does good sleep hygiene actually look like in practice?
Well, it's about creating a conducive sleep environment. A cool, dark, quiet room. Sticking to a consistent sleep schedule, even on weekends, can make a big difference. Limiting screen time before bed and avoiding caffeine and alcohol in the evening can also improve sleep quality.
Those are practical tips that everyone can benefit from, not just those struggling with depression. Now, let's talk a bit more about professional help. We mentioned psychotherapy and medication earlier. How does someone go about finding the right therapist or psychiatrist? It can feel overwhelming to even know where to start.
That's an important step. There are various ways to find a qualified mental health professional. Your primary care physician can often provide referrals. Many employers offer employee assistance programs that provide access to mental health services, and there are online directories, like those offered by professional organizations like the APA, that can help you find licensed professionals in your area.
So there are resources available, and it's about taking that first step to reach out. Now, what about the stigma surrounding mental health? We talked about this earlier, and I think it's a major barrier for many people seeking help. It's like this invisible wall that prevents people from getting the support they need.
You're absolutely right. Stigma can be a powerful force that prevents individuals from acknowledging their struggles and seeking the support they deserve. It's rooted in misinformation and judgment, and it can make people feel ashamed or afraid to speak up.
So, how do we combat this stigma? It feels so deeply ingrained in our society.
Well, it starts with education and open conversations. The more we talk openly about mental health, the more we normalize it and break down those harmful stereotypes. Sharing our own experiences, when we feel comfortable doing so, can also help others feel less alone.
And it's important to remember that mental health is just as important as physical health. There should be no shame in seeking help for a mental health condition, just as you would for a physical ailment.
Precisely. It's about treating mental health with the same importance and compassion as we treat physical health. Now let's shift gears a bit and talk about the role of social support in managing depression. We touched on the importance of connecting with loved ones, but can you elaborate on how those social connections can impact mental well-being?
I think we all instinctively know that, feeling connected to others is important, but it's interesting to delve into the science behind it. Why is it so crucial for our mental health?
What's fascinating is that strong social connections have been shown to reduce stress, boost mood, and even strengthen the immune system. Feeling loved, supported, and valued by others contributes to our overall well-being.
So it's not just about feeling good, it has tangible benefits for our health.
Right. And conversely, social isolation and loneliness can have really detrimental effects on both our mental and physical health.
So nurturing our relationships and making an effort to connect with others is not just a nice to have, it's a crucial aspect of self-care.
Exactly. And it goes both ways. Just as we receive support from others, offering support to those we care about can also be incredibly rewarding and beneficial for our own well-being.
It's that sense of belonging and purpose that comes from being part of a community and network of support. Now, as we wrap up part 2 of our deep dive, I'd like to touch on a topic that often comes up in discussions about depression lifestyle changes. It seems like there's always a new diet or exercise craze promising to cure everything.
That's a great segue. Lifestyle factors play a significant role in both the prevention and management of depression. We've already talked about the benefits of exercise and sleep, but there are other lifestyle modifications that can make a difference.
For example, what are some of the things that people can, focus on?
Diet is a key factor. A healthy, balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, can positively impact mood and energy levels. On the other hand, a diet high in processed foods, sugar, and unhealthy fats can contribute to inflammation and worsen depression symptoms.
So it's about nourishing our bodies with the right nutrients to support both physical and mental health. I've definitely noticed a difference in my own mood and energy levels when I'm eating well.
Exactly. And just as we nourish our bodies, we need to nourish our minds. Engaging in activities that bring us joy, purpose, and a sense of accomplishment can be incredibly beneficial for managing depression. This might involve hobbies, creative pursuits, volunteering, or spending time in nature. It's about reconnecting with those things that make you feel alive and passionate.
It's about finding those activities that spark joy, those things that make us feel like ourselves again.
Precisely. And I think it's important to emphasize that recovery from depression is a journey, not a destination. There will be ups and downs, good days and bad days.
So it's about being patient with ourselves and celebrating small victories along the way, not getting discouraged when we have setbacks.
Absolutely. And remember, seeking professional help is not a sign of weakness, but a sign of strength and a commitment to your well-being. Now, before we move on to part 3 of our deep dive, I want to leave our listeners with a thought to ponder.
Right. What's the food for thought this time?
We've talked extensively about the individual experience of depression and various strategies for managing it. But what about the role of community? How can we create more supportive and inclusive environments that foster mental well-being for everyone?
That's a powerful question. It shifts the focus from individual responsibility to collective action. It's about recognizing that we're all in this together.
Exactly. It invites us to think about how we can create a world where mental health is prioritized, stigma is eradicated, and support is readily available.
That's a great point to end on. We'll delve further into these societal implications and explore some inspiring examples of communities taking action to promote mental well-being in part 3 of our deep dive. Stay tuned.
Welcome back to the final part of our deep dive into understanding depression. We've covered individual experiences, coping strategies, and we even touched on the role of community. It feels like this conversation has expanded outward with each part.
It has been quite a journey, hasn't it? We started by exploring what depression is and the impact that it has on individuals. Then we moved into practical strategies, those tools and resources that can help manage this condition. And now you're right, we are zooming out to look at the bigger picture, the role of community and society in shaping, mental well-being. And in part 2, you left us with a really powerful question. How can we create more supportive and inclusive environments that foster mental well-being for everyone? It's a big question, but it feels crucial to tackle if we really want to make a difference.
Absolutely. Shifting our focus from individual responsibility to collective action is essential in creating lasting change. So let's explore some tangible ways communities can promote mental health and well-being. It's not just about, individual effort, it's about creating a culture that supports mental health.
Okay, I'm ready to dive into that. What are some concrete steps communities can take to create a more mentally healthy environment?
Well, one of the most impactful things communities can do is prioritize mental health education and awareness. This means providing accurate information about mental health conditions, challenging stigma, and promoting, help-seeking behaviors.
So it's about creating a culture where it's okay to talk about mental health, to seek support without feeling judged or ashamed. It's about breaking down those misconceptions and, creating a space for open conversations.
It's exactly. Schools, workplaces, community centers, even, faith-based organizations can play a vital role in disseminating information and fostering those open conversations.
And it's not just about providing information, is it? It's about creating a safe and supportive space where people actually feel comfortable sharing their experiences and seeking help without, fear of judgment. If someone opens up and is met with negativity or dismissal, that can just totally shut down any future attempts to reach out.
That's a crucial point. Another important step is increasing access to mental health services. This might involve advocating for increased funding for mental health care, expanding insurance coverage for mental health treatment, and training more mental health professionals.
It makes sense. Even if we create a culture where people feel comfortable seeking help, it's meaningless if those services aren't readily available and accessible. You can't tell someone to reach out and then have them, hit a wall.
Exactly. We need to ensure that there are enough qualified mental health providers to meet the needs of the community and that those services are affordable and culturally sensitive.
Now, beyond professional services, are there other ways communities can create a more supportive environment for individuals, struggling with mental health challenges? What are some examples of that community level support?
One powerful approach is fostering a sense of belonging and connection. This might involve creating opportunities for social interaction, organizing, community events, and promoting volunteerism. It's about giving people a chance to connect with others who share similar interests or, experiences to feel like they're part of something bigger than themselves.
So it's about building those social connections and support networks that we talked about earlier.